So my name is Dr. Anita Kanthi from North Karnataka, Bagalkot. Today I am here for IUI training under Dr. Pankaj sir. So today I am going to speak about TVS Scan. So this scan is used in IUI for knowing about the follicular study. So this is a TVS scan which has frequency of about 6.5 microhertz, and it is high frequency probe and it has less penetration with high resolution. So this we use for IUI cycles. So for a patient, when we select a IUI patient, we will call her on day 2 for a TVS scan. On this day we do TVS scan to see the AFC count. It is called antral follicular count. So we require minimum 10 antral follicles of size between 2 to 5 mm. So if we find any follicles more than 8 mm or something, they are the previous cycle follicles which we have to cancel the cycle. We shouldn't do induction in such patients. So in this day 2 scan we also see the endometrium. It has to be in a thin line, minimum with 4 mm thickness. So if we find the thickness of endometrium is also less, then that patient is not good for the selection of IUI. So after induction with Letrose for 5 days, we call her on day 9. So on day 9, why do we call? We would like to see the follicle development in her ovaries. So if a dominant follicle has increased in size by 17 to 18 mm, it is an adequate. And we also see the endometrium. It has to be triple layer, and the thickness should be around 8 to 9 millimeters. So if that is adequate, then she is fit for doing IUI. So after day 9 scan, we will call her on after 2 days, maybe on 11th day or something, to see any fluid is there in the pouch of the glass. This indicates there is rupture of the Graafian follicle, mature Graafian follicle, which is indication for ovulation. So if it has ruptured, if we find the liquid in the pouch of the glass, then we will do her a trigger. So this is all.
Dr. Anita, there is one question. I'm Dr. Niti Chaturvedi. I'm from MP, and sorry, I've come from Meerut. I just wanted to ask one question from Dr. Anita. Dr. Anita, is the fluid in the POD is the only indication of ovulation, or would look
no,
like
that even that Graafian follicle which we had seen on day 9, it will not be appearing. It will be corpus luteum will be formed. Okay. So even that you can see.
Okay,
irregular border it will be, and there will be a circle of fire also we will find in some cases. Yeah, on Doppler.
We call the patient on day 9, and after that?
11th day we will call again. To
Why
see.
11th day?
Because if we find it is 18 mm on day 9, the growth of the follicle will be 1.5 mm per day. Okay. So by 11th day it will be 20 mm. So we want to confirm whether it has reached that size.
So what we will do on 11th day?
11th day we will do a scan, and if that follicle has been grown, or then we will give a trigger.
Okay, at what size we give the trigger?
20 millimeter.
20 millimeter. Then after trigger, when we will call the
After
patient?
36 hours we will call for IUI.
So suppose I am starting my OPD at 10 am.
Okay.
So kindly tell me the timing. Should I give the trigger at the same time patient has come to my OPD?
No, we have to adjust the timing, or we can ask the patient to take in her hometown or wherever she is based, so that evening if she takes, she can come day after tomorrow morning.
Evening
10
around what time?
10 am, 10 pm you can come.
10 pm, so that she can come day after tomorrow at 10 am.
10 am for your OPD or clinic to take the trigger.
So ma'am, when she will come after 36 hours, what will we do then?
What, pardon?
Next step will be?
So we will give the trigger, and then already you have given.
We have called the patient
for
after
IUI.
36 hours.
Then we will see her the scanning we do again. So on that day we have to see the collection of fluid in the pouch of the glass. That indicates she has ovulated.
And ma'am, in case if she has not ovulated,
we had to cancel it.
We have to wait for 3 to 4 hours. Sometimes patients
yeah.
3 to 4 hours or 3 to 4 days?
No.
3 to 4 hours.
Ovulate, then you get the cycle going for 10 to 4.
Sometimes in few cases we have to do the IUI in the evening when patient is not ovulated.
Okay.
After 3 to 4 hours.
उसके बाद ये ovulate नहीं.
चलो,
Okay, then. Okay.